Ah, good. You're here. Aileen was just having a look. I was just double checking. I was getting a bit panicked there that you might have had some technical issues. I just said that there's a lot going on in this afternoon. There's still two themes going on around estates and infrastructure, which is obviously a big area for the NHS. Consumables, which I've just been in that room as well. But let me hand over to you. Let's kick off. I'm sure we'll get people joining. As I say, people are flitting in and out of various rooms. I've been doing the same myself today, and I'm hoping some of you might have done the same as well. But yeah, let me hand over to you, Ellen.
Thank you. Thanks, Pete. Thanks, everyone, for joining. It's really good to have you here today. Akanksha, I'm just checking to see if she's on. We've decided to do a bit of a split share screen situation. Give me a moment. Sorry, let me just quickly send her a text. Apologies, one moment.
Don't worry. Just while you're doing that as well, as I say, I'd encourage you all to start thinking, connecting actually in the chat. I've been sort of trying to get people to do that. I've seen lots of that already happening in the other rooms as well. Just thank you as well for putting this session on. As I said this morning, for those that you might that might have been able to join, I really wanted to get an international perspective. We've had a couple of those already today, and I think it's fantastic that we can continue that. And just learn from others, and hopefully, vice versa. If you've been able to join some of the sessions, I'm hoping there's food for thought in some of the innovation that we've been showcasing today. So yeah, please do connect, do chat, make sure you contact, let us know what things that you are interested in. I can see some more people joining. Definitely I can see some names that are involved in IT. Which is no surprising when we've got this session on around cloud technology. But actually, we're going to be talking about clinical care as well. So it's not just going to be a data and IT kind of discussion, because at the heart of all of this is the patient and the healthcare that we deliver. So, Ellen, I'm hoping that bought you enough time. Just have you got your colleague on the line? Sorry, just on mute.
Akanksha, are you on the line? And if you are, could you please share your screen? Otherwise, all good. I'll get started.
Good.
No
okay.
worries. All right, just give me one moment.
Again, what I'm really grateful of is I know that there's a bit of a time difference between some of the speakers today. I've literally just had an email from someone saying, really great session, thank you for letting me join. I've had to dip out now because I can't remember what time he put, but it's getting very late where that speaker was dialing in from. So again, thank you for your time when I know many of you are dialing in from across the Atlantic.
Sorry, she's just struggling to join the meeting and she's presenting right after me. So let me see if I can get her the right link. I'm not sure if the link had changed.
I don't think so, but let me, have you got access to it? I don't know if it helps me putting it in the chat now. Let me just
if you could do that. Sorry about that, everyone.
I think your colleague's on.
Oh, okay, there we go.
just on mute though.
Apologies, I was in the wrong room, but I'm in the right one now. Thank you.
There we go. No worries. Thanks for your patience, everyone. Really appreciate it. Very good. Well, Akanksha, if you don't mind sharing your screen, let's get started.
Yep, absolutely. Okay, I hope everybody can see my screen. So, yeah.
How's it looking? Yep, looks good. Thank you very much. Well, sorry for the false start, but appreciate your time once again. Thank you for joining us today. We'll be exploring how healthcare organizations worldwide are using AWS Cloud Technology as a key enabler of sustainable healthcare systems today. So let's go to the panel intro slide. My name is Eileen Tan. I'm a dentist by training and currently serving as sustainability lead on AWS's international healthcare team. We have a stellar lineup of sustainability leaders today joining me to talk about their experiences on using cloud technology in this domain as well. We have Akanksha from our AWS for Data team, Dr.
Sorry, it's just gone. I've lost sound. Has everyone else lost sound, or is that just me? Yeah, we've just frozen. It's always the case when you run a IT technical digital session that you end up having digital problems, but sorry, you've just kicked back in. You're gonna have to rewind about 30 seconds.
Apologies. Oh, good. Did you all manage to catch everyone that's joining us today with the panel?
No, you're gonna have to start from the beginning, please.
No worries, all good. Well, my name is Eileen. I'm a dentist by training, and I'm now serving as the sustainability lead in AWS's international healthcare team. We have a stellar lineup of sustainability leaders joining me today. We have Akanksha Sheoran from our AWS for Data team, Dr. Daniel Loh, Chief Medical Officer at AdaptX, Misty Michael, Product Manager from Attend Anywhere, Induction Healthcare, as well as Dr. Elizabeth Hansen, Assistant Professor and Paediatric Anaesthesiologist at Seattle Children's Hospital. Our experts will be sharing with you a snapshot of examples to inspire your organization's efforts in sustainability with the help of cloud technology. But first, let's start with the why. And you can see that right on screen today. Why is it important for healthcare stakeholders to drive sustainability in our sector? This morning, some of you may have already heard from Healthcare Without Harm, but in case you missed it, healthcare's climate footprint is equivalent to about 4.4% of global net emissions. Putting this into perspective, if the health sector were a country, it would be the 5th largest emitter on the planet. Now, speaking as a fellow clinician, these statistics highlight a reality we often do not see in the daily busyness of caring for our patients. Our mandate as healthcare professionals is to protect and promote health, and yet, in the pursuit of this mandate, we are inadvertently contributing to a declining environment, which has follow-on impacts on human health, of course. Next slide, please. And of course, the healthcare workforce knows this. In a recent September 2022 Do Not Harm report published by The Economist, 97% of healthcare professionals surveyed across the UK, Germany, and France said that sustainability should be part of their role. In fact, Nick Watts, the first Chief Sustainability Officer of the NHS, recognized that 9 out of 10 NHS professionals actually want to see NHS tackle climate change. Next slide, please. We can talk about so many reasons, honestly, about why driving sustainability in healthcare is so important. And I'm probably preaching to the converted here if you're joining this session today. But I think we can all agree that it's simply the right thing to do. I'm going to pause here to let you have a quick read of this quote by the Director General of the WHO. Hopefully you're a quick reader. For me, what resonates the most with this quote is that last piece there. The fact that places of healing should be leading the way and not contributing to the burden of disease. I highlight this quote to inspire us because while climate change presents us many challenges, the opportunities might just be as great. And as healthcare leaders in this space, we are in a unique position to take a leadership stance on climate change. Next slide, please. So with that, let's consider where we could look to become more sustainable in healthcare delivery. Let's start with the goods, inventory and supply chain that we use to provide care with, right? How can we look to improve inventory management to reduce waste, for example? And next, how can we look to optimize buildings and facilities where care takes place? For example, energy use, water use, your IT infrastructure, heating and cooling. Hospitals are actually one of the most energy intense commercial buildings like in general, right? So how can we look to make hospital buildings more efficient, both on the energy and water side? And finally, this is where I think a lot of us shine the brightest, which is care delivery. We do this because we care for our patients. We want to make sure that we can deliver good care. How can we improve patient outcomes through innovations that optimize the use of physical, financial, and human resources? And finally, let's not forget also the intersections of this Venn diagram. So for example, taking a look at how you optimize building design will have an indirect impact on buildings and infrastructure, how to become more sustainable in that pillar, as well as how we make care delivery more sustainable, both for in terms of clinician burnout as well as patient journey. So with that, in each of these bubbles, if you think of all the different use cases and opportunities that lie within to become more sustainable, to optimize, to reduce waste, each of these use cases may have IT workloads associated with them. So to the next slide, please. And where these workloads, these IT workloads exist, this is where you can collaborate with us at AWS. And we see your sustainability journey with us in these three different stages: sustainability of the cloud, in the cloud, and through the cloud. Of the cloud is really talking about how you might want to decide to migrate your IT workloads to the AWS cloud to leverage already the data center investments that we've made to make our infrastructure as sustainable as possible. Sustainability in the cloud speaks to, once your workloads are already in the cloud, how you might want to go even further using our best practice guidance and carbon footprint calculator tool to even optimize further your IT workloads and gain that additional benefit. And finally, sustainability through the cloud. This is my favorite pillar. I consider this a bit the innovation pillar. And this is where, once you are already building in the cloud and you're using cloud technology services, that are things like AI, ML, and analytics, how you can actually use those cloud services to build net new solutions that can then drive sustainability efforts at your organization. So with that, I'm now going to hand over to Akanksha, our expert in data strategy, to help us understand how can we begin thinking about leveraging data to ensure that our sustainability efforts are always grounded in data. So give us a moment to swap our screens. Very good. So I'm going to now swap my screen and share mine. One moment. Let me know once you can see the presenter view. Just give me a moment.
Perfect. We can see this slide, but we don't see the presenter mode yet.
Is it on presenter mode now?
No, I don't think it is actually.
Apologies. One sec.
Try one more time.
Yeah, one more time. One moment. I'm sorry, I can't seem to get my presenter mode to be working.
We'll try just sharing your screen one more time, and we'll just have an assessment about how, because we could obviously see the screen, and there might be a slight workaround by just zooming in slightly. So let's just try that.
Yeah.
If not, what we could do is just move to one of the other presenters and then maybe come back as well. We could do it that way, couldn't we? And then you can send me your presentation in the interim. So let's just give that one more time, and then if not, email me.
All right, sounds good.
What I can, okay, give it a go. Otherwise, I can just share my screen. That's
there we
fine.
go. That looks perfect. Excellent.
Okay.
That'll be fine at that size. If you can go in presenter mode, brilliant. If it can't, that is absolutely perfect.
I don't think I can go on presenter mode, unfortunately. Apologies for that.
Keep it with there as long as that looks fine.
No worries. Akanksha, over to you.
Okay, no worries. Perfect. So I'll get started on this. So, data strategy with sustainability in healthcare is essentially a forward-thinking approach for us, right? Where we are merging the two technologies, the two thought process of, the critical needs of healthcare system along with data management, right? Now, it involves leveraging data to optimize operations, to improve patient care, reduce environmental impact, right? Now, to embrace the journey of data strategy and being sustainable at the same time, there are several ways we can do that. And I'll just mention one or two and then get started there. The first one is, data can be used to enhance the efficiency of healthcare processes, reducing resource consumption and waste, which would eventually lead to cost savings and reduce environmental impact. Secondly, data can significantly improve patient outcome and quality of care. So by harnessing the data analyst and predictive modeling, healthcare organization or the healthcare providers can actually personalize the treatment plans, reduce errors, and enhance the preventive care. And this will also improve the patient's satisfaction. And thirdly, data can help healthcare organization meet sustainability goals by monitoring and reducing the carbon footprint. This includes tracking the emission from transportation, energy consumption from hospitals, and waste management. And these are some of the places where data strategy can help you meet sustainability, and they both can go together. And what you see on the screen right now is, this is a quick definition of data strategy organization that you see, right? At AWS, we have our own data strategy model that we have defined, and it will help you to make more data-driven organization along with sustainability in mind, which combines technology with mindset, people, and process. Next slide, please. So in this slide that you see now is you can see a combination of a couple of pillars that you see here. So the first one is mindset, and then we have people, process, and then we have technology, right? A lot of people, when I ask them what is data strategy, everybody thinks data strategy is related to technology, right? What is the latest technology you're using? But that's not accurate. Data strategy is a combination of technology along with mindset, people, and process, right? And this is where AWS can help you. So I'll just quickly go through these pillars to give you some examples of what a data-driven organization is basically. So for mindset, right? Traditionally, we have been focusing on technology, right? But now we have to shift that mindset to be more customer focused. Focus on the customer need and pain points and work backwards from that problem to solve that problem, right? We need to have more cross-functional collaborations, right? I've heard it from so many healthcare organizations that there is absolutely no collaboration between technical teams and the business team. So we need to form like two pizza teams. At AWS, we have this very common analogy of forming two pizza teams to achieve quick goals and revise them as well. So we need to have a collaboration between IT, sustainability, and healthcare team and the business and the technical teams all working together to align the data strategy with sustainability objectives. And the last one is, technology, right? So we need a modern data strategy, which is like more flexible, cloud-based, which is tailored to your business need, right? Going back again in technology, right? Traditionally, what used to happen is, when we all started building our platforms, we all said, oh, you know what, let's use technology, which is like one size fits all approach. But that's not the case anymore. We actually work backwards from the problem. We say, how do you want to utilize the data? Do you want to utilize the patient data to look at, the medications, or do you want to look at the number of beds in the hospital, things like that? So you work from the problem and see how do you access and store that data. Next slide, please. So AWS, AWS actually provides the most comprehensive and highest performing set of capabilities for an end-to-end data strategy, right? We support your workloads from data lake and data warehouse to securely ingest and combine, and then run the predictive analysis on your data in just few clicks. We have a couple of services, just to name. We have Amazon SageMaker that can support you to build and train machine learning modules. We have QuickSight as a business intelligence service with the ability to analyze and visualize your data, right? To summarize this, we provide a comprehensive set of data services, so you don't have to compromise on performance, cost, result as well. And we continuously accelerate our pace of innovation, introducing new features and services, so you will never outgrow AWS for your data needs. Yeah, so this is all from us, and we are here to help you and build that end-to-end data strategy model. And let's not forget, it's just not technology, it's also about people, process, and mindset. Thank you.
Thanks, Akanksha. That's really enlightening. Appreciate that. I really like the fact that it's not just about technology, and we also have to take people along with us in that.
You've just frozen again, Eileen. I think.
Yep.
Lovely.
That's not a problem. I can just share the slides on her behalf. Let me know if you see my screen, and we can go from there.
We can, yeah.
No worries. Sorry, can you hear me?
Yeah, we can now.
Good, thank you. Sorry about that. I cut out for a second. I wanted now to transition actually to ask Dr. Lowe a question. In your experience at AdaptX, Dr. Lowe, how can data and analytics really help with tackling greenhouse gas emissions? On mute.
Thank you very much, and good morning from Seattle. Yeah, I think Akanksha's last slide or first slide summarized it all. The technology piece is just one part of the solution, but it really starts with mindset, and you'll hear from Dr. Liz Hansen. That's where it started, and the technology piece is just another piece of the puzzle. But just to back up, I mean, the NHS, like any other modern healthcare system, has invested heavily in the last decade from transitioning from paper records when I trained in the NHS 20 years ago to electronic medical records, just like most of the world, the developed world, at least the healthcare systems. Now, the advantage of having electronic medical records is now your system, your healthcare system, is generating vast realms of real world data every single day, probably at a faster rate than you can consume it. So where does this come into play when we talk about sustainability? Well, one of the last bastion of any hospital to transition to electronic medical record is the operating room, because that's a fast-paced, volatile area, and so that's usually the last place it penetrates. But in the NHS, we have got there in many NHS trusts, and now it turns out that the carbon footprint from the operating theatres is a huge contributor to Scope 1 emissions of any hospital. And we'll be hearing more about that and how that can be managed. So the data piece is really important. You are capturing it right now. We do have cloud technology. Thank you to AWS for that infrastructure. AdaptX is just a solution that sits on top of the infrastructure you've spent 2 decades plus building, and now all the pieces are coming together. So that's my quick snippet on that.
Thank you, appreciate that. So you alluded to Dr. Hansen at Seattle Children's driving some of these initiatives just before. Dr. Hansen, do you mind telling us more about this initiative that you've spearheaded at your hospital that's helped to reduce this OR emissions?
Absolutely. So thanks for having me. As Dr. Lowe mentioned, the inhaled anesthetics that we use for most of our anesthesia care are greenhouse gases, and they can be responsible for up to 40% of a hospital's Scope 1 or direct emissions. For our hospital at Seattle Children's, when we first started this work, they made up 7% of our total hospital emissions, including Scope 1 and Scope 2. So it was a pretty significant contributor to our carbon footprint. So we looked at the evidence and the literature to find evidence-based strategies to implement that would help us reduce these emissions by tenfold over the course of this project. And those included education and socialization, practice constraints and protocol changes, as well as direct data feedback using AdaptX. So as Dan mentioned, AdaptX sits on top of the electronic medical record and is able to pull the data that we need to calculate the carbon equivalents of our anesthesia gases and give us that data so we can see which cases, which anesthesiologists or anesthetists are emitting how much, and then use that to further intervene and decrease our emissions. So with that, we implemented Project Spruce, which reduced our emissions tenfold over the course of the project. And then we worked as a team. In the next slide, you can see the fishbone diagram where we identified, this is the inventory of our emissions from the total hospital, showing that anesthesia gases were 7%. That's the only clinical category that you'll see on this pie chart. The other top emitters are natural gas and commuting. And we made a commitment, our leadership at Seattle Children's made a commitment to providing carbon neutral care by 2025. So it's really important that we tackle this work to help achieve that goal. And then the next slide, you can see the fishbone diagram where we worked as a team in the anesthesia department to identify the causes and problems that we saw that were contributing to the high greenhouse gas emissions so that we could really target our efforts. And all of this was using data from AdaptX, so we could actually see which cases we were having the most trouble with. And all of that is on the cloud.
Wow, really amazing. Very, very cool. And can you tell us more about this initiative called Project Spruce? I understand that it started out of Seattle Children's. How did it grow from there?
Yeah, so this is a problem at most hospitals. You know, we're all using these inhaled anesthetic gases that are potent greenhouse gases, and some of which also deplete the ozone layer. So when we started sharing this work, there was a lot of interest in how others could implement these same strategies, the same evidence-based strategies that we were reading about and trying at Seattle Children's. So we formed a consortium of pediatric hospitals and anesthesia groups around the world who have committed to using the same methods and reducing their emissions from inhaled anesthetics by 50% over the course of a 12-month study period. And so we have 10 hospitals that have joined on and committed to doing this work together. And we're seeing interest from adult hospitals as well. And so we're forming another consortium of adult anesthesia groups and hospitals to tackle the same work.
Very cool. And are NHS organizations open to join this initiative?
Everyone's invited.
Okay, that's your call out there to everyone else who's listening here today. Make sure you get in touch after this call. I can see a thumbs up. Thank you for that. Very good. So let's come back to data flow and understanding how you've captured the anesthesia gases in the OR room, analyzed it, and like what sort of policy interventions came out of that. What was that data flow looking like? Sorry, that's two questions. Data flow first, and then policy interventions after.
I can talk about the data.
Yeah, I was just going to say, Dan, you should.
So the data flow. So if you go into any of your operating theatres in the NHS, your modern anesthesia machine is capturing gas flow, oxygen, nitrous oxide, air, and the agent that keeps the patient asleep. Now you have to do some math in the background and convert that into a CO2 equivalent, so you can actually compare apples and apples. So that's what happens in the cloud, and that's what AdaptX is able to do. Now, the secret sauce here is you have to be able to convert that into a number that someone can understand and tangible. So how much CO2 you're producing per minute, and then you have to be able to stratify it to, well, what kind of patient was it, and who is doing it, and how often are they doing that? And it's that kind of like provider level feedback. So in this diagram, it's interesting that everyone's come to the same boxes: people, materials, processes, right? And the technology piece is kind of the bookends. We have the data that's being fed, so you can now measure it if you have the technology. And the adage, you can't manage what you don't measure, is true, right? So if you don't actually measure it, you essentially have an unmanaged process. And AWS are obviously leaders in this, and that's how they built a gajillion-dollar business from like managed stuff and lots of A/B testing. And when you apply interventions, can you rapidly see if they work? And that's the key, so that your ability to learn quickly from rapid iteration cycles.
Very cool, thank you. And Dr. Hansen, the policy aspect. So what changed at Seattle Children's to help you make that big reduction?
Yeah, a lot of different things. So looking at this fishbone diagram, you can see where we identified some of the problems and we tackled it in multiple different ways. So I talked about education and socialization. So some of that was just really informal discussions in the break room where people were sharing their ideas. And especially once the data started really flowing in and I was giving monthly reports using AdaptX data, people would really get excited about it and be competitive. And you know, that socialization part really took hold. We also implemented some constraints. So we stopped using some of our most high impact agents like desflurane, and we dramatically reduced our use of nitrous oxide. And those are two of the more potent greenhouse gases. And so that helped a lot too. We made some changes to our technology in the operating room. So our anesthesia machines defaulted to a very high fresh gas flow. And this is kind of in the weeds for those of you who are not anesthesiologists or working in the OR. But if you reduce that fresh gas flow, then you can be more efficient with your anesthesia use. And so basically that just reduces the amount of waste while not affecting the amount of anesthesia that the patient is receiving. And then just changing some of our processes and protocols. And if you go over to slide 5, we implemented these changes over time. The next slide. And you can see one more slide forward, please. This is the same data that we showed at the very first slide of that tenfold decrease over time, but it's broken up into different sections of time and then shown instead of the average for the entire department. This is by anesthesiologist. So each of these points represents me or one of my colleagues. And so you can see at the beginning in blue at our baseline, there was a wide range of where emissions were for each of us. And then as we started implementing these interventions, we narrowed our range. So we became more consistent between ourselves and people responded differently to different steps along the way. And so you can see like anesthesiologist A is someone who does a lot of cases. So they're on the far right of the screen. They're very, they're in the operating room every day, doing a lot of cases and doing high flow cases and higher emissions cases, and didn't really respond to the socialization and education, didn't respond to some of the practice constraints. But when we started having some data feedback and I think some of the practice constraints caught up with them, they had a 50% reduction. So they're an outlier now. They're much higher than everybody else, but 50% lower than where they started and below average from our baseline. Anesthesiologist B was the highest at the beginning, responded really quickly to some of the education and socialization and had a big decrease, and now is totally middle of the pack at this new low baseline. So really responded to these interventions. And then anesthesiologist C is someone who I think initially thought that they were very, very low emissions because some of the practices that they had, but then didn't really know that some of the practices that they were doing were contributing to high emissions until we started having these constraints and data feedback. And then they realized, oh, I have to do more than just what I was doing. I'm still having high emissions, so let me further change. So everyone had a different journey through these interventions, and with the data feedback, we could really pinpoint where the issues were and where we still needed to focus, and then celebrate those really great success stories as well that we've all come down together in such a dramatic way.
This is such a heartwarming story because it's what data should be doing, right? Going back to your original opening, you should be delivering insights to the customer, to your user, and they should be reacting to that insight and changing the behavior. If you want to change something really big like healthcare industry, you have to change individual healthcare systems. But healthcare systems are made of people. So at some level, you have to change the behavior of individual people. And the only way to do that is to give them a mirror into their practices and how it affects not just the patient in front of them, but the world. So this is just a micro example at a local level of a global problem and how we're tackling it. It's a beautiful story on how to use data and feedback loops.
That's really amazing. Thank you. And I was just about to reflect the same thing. I mean, as a clinician, to be able to see that sort of data-driven quantification of how I'm doing, to be able to then motivate me to say, oh, I should be doing more. I should be, thinking about things maybe a little bit differently. What a great tool. What a great tool. Thank you. Dr. Hansen, maybe a final question for you then. Beyond environmental, positive impact that you've seen through Project Spruce at Seattle Children's, what other benefits have you seen besides, reduction of emissions and reduction of anesthesia gas use?
Yeah, so I think, reduction of emissions is obviously the main goal for us, and the excitement and positivity that I see in my colleagues and how hard they're working to deliver really high quality, effective, safe care while reducing the carbon footprint of what we're doing is just amazing. And it's helping us achieve our goal as a hospital of delivering carbon neutral care by 2025. So, being part of that greater goal and being part of that effort is really, really rewarding. We're also saving a lot of money, and this was kind of a secondary benefit because we're more efficient with our anesthesia gas use. We're able to sort of reuse the same molecules of anesthesia gas for the patient over and over again throughout the case, because these aren't really metabolized by patients. So we can reuse them if we're efficient and we make good choices with how we deliver the anesthesia. And so that allows us to waste a lot less of these anesthesia gases. And like I mentioned, still provide really high quality, safe, effective care with no impact on those safety issues with patient experience or anything like that. We still have very high satisfaction scores, and we're monitoring all of those balancing measures to make sure that we didn't have any unintended consequences of this work. And then the cost savings has been really significant when we stopped using desflurane, which is a very expensive agent. That gave us some cost savings, but our workhorse, sevoflurane, which is what we use for nearly all of our cases, we're still using it, but we're using it more effectively and efficiently. And so we've managed to save quite a lot of money, over $175,000 a year for our hospital. And then I just wanted to mention as well that having the data allowed us to identify another problem in the hospital that others have seen as well. And I think we have a slide for this too, in slide 6. If you could go forward to here. So this is just a simple graph. In red is the same slide 1. So that's our measured emissions using AdaptX data for all of the operating rooms inhaled anesthetic gas use over the period of time that we did this study. And then what we were always measuring before was our purchasing data. And you can see that this is broken down by which anesthesia gas we are looking at by color here. So nitrous oxide is responsible for the biggest carbon footprint of our anesthesia gases, and that's still the case. And we're not really using it. So you can see our use has come down tenfold. Our purchasing has come down as well, but not nearly as much. And that's because there are infrastructure waste that occurs in all piped nitrous oxide systems in all hospitals. And this is something that's been published out of the UK actually first, but we're seeing this all over. Everywhere that's looking, we're seeing these inefficiencies in the system with the centrally piped nitrous oxide supply. And we can very safely convert over to cylinders that are closable in between uses that can be put on the back of the anesthesia cart or even in dental clinics and other places. So there's an alternative to continue using this when it's medically necessary, but eliminate the amount of waste that we're seeing. And the data here is what allowed us to identify this problem.
Thank you. That's really, really cool. I really appreciate that. So as a final question then, can you tell us a little bit more about Project Evergreen? You mentioned briefly before that you're expanding this now to adult care as well. How would you get started? How would you get involved if you were an NHS organization keen to join?
Yeah, so I think we have the final slide with a QR code, hopefully. So we have a website, and you're welcome to email me directly or Diane Gordon, my co-PI for Project Spruce Forest, the pediatric side. We are recruiting for phase 2 of that. We already have our phase 1 consortium going. But yeah, phase 2, we're still open. So please email me or go to the website and reach out. And then for Project Evergreen Forest, we're getting started with recruiting for phase 1. So again, it's a tab on the same website, and feel free to email me. Thank you.
Thank you. Very good. Well, now let's move on to a different area of healthcare delivery. I want to talk a bit more. I want to invite Misty to talk a little bit more about telehealth. So, Misty, when you're ready.
Sure. Okay, let's see if I can maintain the good sharing karma we've had so far. Is everybody able to see my screen?
Yes, we can. Very good. So Thank you so much for joining us, Misty. We know that telehealth has played a hugely significant role, especially during the pandemic, especially in the NHS as well. Can you tell us about that time and how did Attend Anywhere, the product that you manage, help the NHS? And which clinical care domain specifically was delivered by the Attend Anywhere telehealth solution?
Sure. So prior to the pandemic, Attend Anywhere was already used throughout Scotland and Wales. As a response to the pandemic, it became a real pressure in the NHS to expedite the adoption of video consultations in various sectors, including mental health, community services, all sorts. So to achieve this goal, national license was procured and funded by NHS England and NHS Improvement, and the Attend Anywhere team began the process of sort of onboarding the vast majority of trusts across England. The process of onboarding is pretty straightforward. There's a seamless integration of Attend Anywhere. Most of the complexity lies in sort of configuring our individual user setups and optimizing waiting areas so that we can kind of emulate that in-person experience for the patient. Because it's a cloud platform, it has a little bit of inherent scalability. So we worked really closely with the AWS Cloud team to ensure we had that sort of infrastructure to support the rollout. Aside from a few unexpected challenges during that expansion, we successfully implemented the platform across England in about 12 weeks, whereas previously our roadmap had estimated about 18 months under less pressing circumstances. As part of that, we started looking at some data and we observed that the number of consultations conducted through the platform in England was under 5,000 for March 2020. So that's sort of like the first month that we rolled out. That figure kind of surged dramatically, reaching over 340,000 consultations per month by the end of March 2021. So in total, we facilitated about 3 million annual consultations, all on this one unified national framework. So following the launch of it, an independent study was facilitated by Edge Health, and that focused on quite a lot of the outcomes of the rollout. You can see here some of the data they've gathered around the impact of using Attend Anywhere throughout the pandemic from a sustainability perspective. So one of those was fewer missed appointments. Do not attends are massive focus of the NHS, very costly. And we noted that we saved about £6 million as a result of the reduction in missed appointments in comparison to your normal sort of face-to-face appointments. Also, the economic benefits in terms of working times. So about 3 million working hours saved and 108 million in labor productivity gains. Basic travel cost savings for patients. So 40 million saved, not in just your normal sort of travel expenses and car expenses, but also parking charges and other sort of travel related expenses that a patient might incur. We've noted that there was an improved patient flow. So we avoided about 3 million physical attendances and about 35,000 emergency department visits, which is huge. Massive reduction in waiting times, over 2.25 million hours. Time savings for travel and waiting times. And in addition to that, things like greenhouse gas emissions avoided was 14,200 tons and 46,000 tons of PPE saved from the landfill. So that's just a little bit of data that was gathered from the independent study following the implementation. In addition to that, there have been some case studies done by our customers. NHS Grampian, for example, is an oral surgery pathway. They noted in their case study that around 4,000 miles of travel were saved, just as a result of only 88 remote consultations over 2 months. So quite a cost savings for them. Dorset Healthcare noted that their mental health service staff travel costs reduced 10% due to multiple factors. And Ashford and St. Peter's noted that they had saved 130 kilograms of carbon emissions per 1,100 consultations. They also noted that it was more efficient than face-to-face. So for first appointments, 92% were discharged or didn't have any face-to-face follow-up compared to 60% prior to using the video consultation platform.
That's so impressive. As a clinician myself, I always thought, the biggest role of telehealth was increasing access to care. I used to be a country dentist working 200 kilometers from, the next capital city, and we were using telehealth for this. But to then think about the impact on the environment, how much you're saving in terms of travel and the related emissions is really, really incredible. I'm really so impressed by these numbers. Thank you. So in your experience then, Misty, especially as a product manager, and helping to roll your product out so that it's in a way that's very data driven, what are some best practices can you recommend for implementing telehealth in a sustainable way, considering factors like device reuse, recycling, that sort of thing?
Yeah, absolutely. So we look at a lot of different things as well when we talk about metrics. So there's a couple of things before I get to those bits that we look at. So we talk a lot about carbon emissions and travel costs. We also look at things like reduction in medical waste, energy savings, water conservation, infrastructure cost savings, and patient satisfaction, and things like that. So we take all of those things sort of into accountability as part of the metrics that we look at as we're sort of improving and rolling out our product further. For me, I think device reuse, telehealth solutions have to consider factors that won't require an upgrade. So for us, we decided not to roll out an app. I know it's the newest and greatest thing to have an app for your product, but we decided not to do that because it means our patients won't have to upgrade to a newer device. It means hospitals won't have to upgrade to newer technology and things like that because it will run on some of these older machines, saving a bit of cost and saving a bit of waste, electronic waste as well. For recycling, we would suggest you establish and promote e-waste recycling programs for outdated or non-functional devices. There's a lot of partnerships for the clients that we work with that partner with e-waste recycling organizations to make sure that if you do need to dispose of old devices, you can properly do it and recycle old electronics and things like that. And probably the most important one to me as a product manager is just to design a platform with a user-friendly interface and functionalities that sort of minimize that need for complex device setups and configurations. I don't want my 70-year-old grandmother to struggle to have a video appointment when she's already stressed out, certainly. So we put quite a lot of focus onto that user experience and make sure that it's as intuitive and easy as possible and can run on multiple different devices of multiple different ages. So those are the things that I really like to focus on.
Fantastic. Thank you so much. Really appreciate that.
Yep.
Well, that's really it from us today. I hope that this session, although it was a really speedy one, maybe with a few technical difficulties at the start, I hope that it really helped to showcase the breadth of opportunity that we have within healthcare. We only really talked about AdaptX and the work they've done at Seattle Children's, as well as Attend Anywhere and the work they've done at across the NHS. But really, where can we be more inspired, and where can we further, create new solutions to not just reduce environmental impact, but also make care delivery more sustainable as a whole. So with that, thank you, Akanksha. I wanted to share with you this QR code on screen here. We actually recently released a blog post also talking about AdaptX's wonderful work, as well as Induction Healthcare's work in telehealth. So you can read more there. And certainly do feel free to get in touch with us. You have all our names there. We're all available on LinkedIn. Pete, you've got a hand raised.
Thank you. Yeah, just the next session starting at 3 o'clock, where we're just going to wrap things up. So I was thinking it'd be rude not to just use these last 10 minutes and throw a few thoughts at you, and maybe some people online and listening in might want to do the same. The anaesthesia stuff does interest me, only because, I mean, there was a session on today about capturing of anaesthetic gases. We are aware in the UK through the Greener NHS team of work that they've done on helping green the anaesthetic pathways. But what I'd love to do, and what I am in the process of thinking of doing, is just bringing a group together. Actually, there's a great couple of people that are well connected to the like the Royal Colleges, etc. And I think this would be good just to shine a spotlight on and see what might be of interest to people. And as I said, I'm always keen to learn from other parts of the globe. So thank you for presenting that. So that was really interesting. And the other thing that just sort of struck me as well when Misty was talking, isn't it great when we see all these case studies? But one of the challenges is that all of this information is all over the place. I mean, I've just put it in the chat, actually, a bookmark bar that I collate that's a bit informal, but it's got nearly 700 things. But what I was acutely aware of is that everyone creates a website, but you almost need that mass of information, which is why I'm really interested in topics like artificial intelligence, because the human brain, we just can't compute the amount of data that's out there. So I think I don't know if it's an observation if anyone can help, but how do we continue to shine a spotlight on all of this brilliant data, this evidence, that allows people to find it easy and to be inspired? And I don't know if anyone's got an answer to that challenge, but it's a shame, because then you only stumble across brilliant work through sessions like this, when actually we need to give it to people and have it at their fingertips. So just a few thoughts from me, and I'm hoping that people might jump in as well with a question or two.
I think, Pete, a great call out on collecting information, and it's it's a problem with any domain, I think. But certainly, it sounds like maybe you're tending towards something like a knowledge management system, and that's something that we can have a chat offline to see how we might want to stand something like that up for the AHSN if this is something of interest. Again, going back to the data strategy piece that Akanksha helpfully shared with us, it's all about firstly getting the data unlocked from its different silos, bringing it together, converging it, applying the analytics layer so that you can derive then useful insights that you can then take action on, like how Dr. Hansen has suggested, elaborated before on the policies that came out of a data-driven data flow process. So fascinating talk today from everyone. Thank you so much for joining us. We do have about 8 minutes left. We can certainly, give everyone a bit of a break before the end of the day. But otherwise, Pete, I'll hand back over to you.
No, thank you. I was just putting in the chat the link to the final session of the day. I'm fairly certain that is the final session of the day link that I've just put in the chat. But it's been a long day so far, and I say thank you for your time when you're dialing in from different time zones as well. But no, really enjoyed the session. I can see some good comments as well, people wanting to connect, people wanting to use resources, and I think hopefully the start of ongoing discussions really is the nub of it. So thank you for your time. I'll let everyone go and get a comfort break, and as I said, if you can spare another 20 minutes, please do, and we'll wrap up. Thank you.
Thank you so much.
Thank you.